Hey everyone, my name is Michelle Westerman and I am a resident at Blanchard Valley Hospital. We have been asked to go over a few lectures with you regarding what you're going to have on the NAPLEX. And my lecture is on the over-the-counter items that are not GERD related. If at any time you guys have any questions for me regarding this, my email is located here on the first slide. Please use this email as it's my work email and I check it every day. I do not typically check my Finley email. After the lecture today, the student will be able to recall the various categories of over-the-counter medications, list treatment options for various conditions, recommend specific products upon patient request, and demonstrate learning through successful completion of the NAPLEX exam. There are a few things we should know about natural products. The board doesn't exactly touch a lot on this subject, but there are some things that you should know. Manufacturers of dietary supplements do not have to prove the safety or efficacy of a product before it is marketed. And it's important as pharmacists to know significant interactions with natural products and prescription medications, and I've listed two examples, such as St. John's wort with birth controls and antidepressants, and ginkgo with anticoagulants. And I have also listed on this slide the Natural Database website. That is a good website to go to if you ever have questions about natural products. As far as calcium and vitamin D, calcium absorption is saturable and doses should be separated. The body can typically only absorb 500 to 600 milligrams of calcium at a time, so it's important to inform patients of this as well. Calcium requires vitamin D to aid in absorption. Calcium citrate, which is the calcium in Citracal, is better absorbed, can be taken with or without food, but it's often a larger pill. Calcium carbonate in Oscal and Tums is acid dependent, and it should be taken with meals. I have not included a whole lot of information about vitamin D itself, but it is important to know both the calcium and vitamin D daily recommendations for people of certain ages and genders. There are a couple over-the-counter agents used for mild pain or headache, and the first, of course, is acetaminophen. The max is 3 grams daily, and dosing recommendations may vary based on the manufacturer. For example, if you have a 500 milligram tablet product, that can be taken 1 or 2 tablets every 4 to 6 hours. This dosing will vary if you've got a 325 milligram tablet or the extra strength, the Tylenol arthritis 650 milligram tablet. Acetaminophen is the safest over-the-counter pain medicine for patients taking warfarin. And then we have ibuprofen. The over-the-counter labeling for ibuprofen is 200 milligrams every 4 to 6 hours, with a max of 1,200 milligrams per day. And this is important because this dosage is different from what patients could typically see on a prescription medication. The treatment of over-the-counter use of ibuprofen should only be for 10 days, unless recommended by a physician. We want to use caution with ibuprofen in patients with cardiovascular disease. We also have aspirin, and aspirin dosing varies widely based on the indication. I have listed all of them here, but it's important to know that for anti-inflammatory use, the dose is much higher than analgesic or antipyretic uses. However, the max grams per day remains the same. And then in primary prevention, typically we see 81 milligrams a day, but it could be anywhere from 75 to 162 milligrams a day. And we want to avoid chronic doses of greater than 325 milligrams, that's per day, in the elderly. We also have Excedrin combination products over the counter. Most of the products nowadays, after the big recall a few years ago, contain just aspirin, aspirin, Tylenol, and caffeine. There used to be some products that just contain caffeine and Tylenol, but I think most of those have been removed off the market. You may still, however, find some stores that have their generic product as such. Excedrin dosing is 2 tablets as 1 dose, with a max of 2 tabs in 24 hours. The next thing we'll talk about is antihistamines. They're considered the first-line agents for mild to moderate symptoms, and they block histamine at the H1 receptor site. They reduce itching, sneezing, rhinorrhea, but they have no effect on nasal congestion. Second-generation products are usually preferred as these cause less drowsiness and cognitive impairment. The first-generation antihistamines are listed on this slide. The first is diphenhydramine or Benadryl. The adult dosage here is 25 to 50 milligrams every 4 to 6 hours with a max of 300 milligrams per day. Diphenhydramine is highly sedating, and this is important to counsel patients on. Then we have chlorpheniramine. The dosage is 4 milligrams every 4 to 6 hours with a max of 24 milligrams per day. Chlorpheniramine is less drowsy than diphenhydramine, but is still moderately sedating. And we should avoid use in the elderly based on the Beers criteria. The side effects can be increased in elderly, and the side effects are listed below here. We want to also use caution in patients with cardiovascular disease, BPH, and glaucoma. The first-generation antihistamines are safe in pregnancy. However, chlorpheniramine is the first-line agent. The side effects for the first-generation antihistamines include sedation, cognitive impairment, and anticholinergic effects such as dry mouth, blurred vision, urinary retention, and constipation. As far as second-generation antihistamines, we have cetirizine. The adult dosage is 5 to 10 milligrams a day, and this is the most sedating of the second-generation agents. Then we have fexofenadine. The adult dosage is either 60 milligrams twice a day or 180 milligrams daily. And with fexofenadine, we want to be careful to avoid orange, apple, grapefruit juice, and acids within 2 hours of fexofenadine. With loratadine, the adult dosage is 5 milligrams twice a day or 10 milligrams once daily. And again, we want to use caution with these agents in patients with cardiovascular disease, diabetes, glaucoma, and BPH. And all of these agents listed here can be used in children 2 years and up and are labeled as such over the counter. Next we have the decongestants. They are alpha-adrenergic agonists or sympathomimetics, and they cause vasoconstriction. The two we have over the counter are phenylephrine. Adult dosage is 10 milligrams every 4 hours as needed with a max of 6 milligrams per day. Then we have pseudoephedrine. The adult dosage is 60 milligrams every 4 to 6 hours as needed with a max of 240 milligrams per day. This has been found to be the most effective over-the-counter decongestant. However, as all of you probably know, pseudoephedrine is the agent that has to be purchased behind the counter and can only be purchased when pharmacies are open. These should not be used within 14 days of MAOIs. And we need to use caution in patients with cardiovascular disease, hypertension, diabetes, glaucoma, BPH, and the elderly. And this is especially important for pseudoephedrine, especially with hypertension. We aren't 100% sure with phenylephrine what the implications there are on hypertension, but it is safe just to say for patients with hypertension, they should avoid using phenylephrine or pseudoephedrine for any more than 3 days at a time. And both of these agents are pregnancy category C, therefore use should only be recommended by the patient's physician and never by a pharmacist. We have a few over-the-counter nasal decongestants, and the ingredients are listed here: oxymetolazone, phenylephrine, tetrahydrolazone, and the side effects here are stinging and burning, dryness, and rebound congestion. Because of the rebound congestion, these agents should only be used for a max of 3 days, and that is very important to counsel patients on. We have some natural products that are available over the counter to help with colds, and patients will often ask you what the effectiveness of these agents are and if they should be taking them while they have a cold. The first one is zinc. There is little efficacy data for use in cold prevention, and it's rated possibly effective by the Natural Medicines database. However, it may slightly decrease cold duration, but has to be taken every 2 hours while awake, starting within 48 hours of symptom onset. Then there's vitamin C, which may decrease the duration of a cold by 1 to 1.5 days, and it's been rated possibly effective by the Natural Medicines database. Then we have echinacea, which has been rated possibly effective as well. So when patients are asking about these, it's important to tell them that the use is only possibly effective, especially with the zinc. It has to be taken at a certain dosage throughout the day in order for patients to see any benefit. Next, we have the various over-the-counter cough products. The main two ingredients are dextromethorphan and guaifenesin. With the dextromethorphan, it's the most commonly used cough suppressant, and it blocks the cough reflex center in the brain, as well as acts as a serotonin reuptake inhibitor and NMDA receptor blocker. The guaifenesin is the expectorant used to decrease the thickness of the phlegm in the lower respiratory tract, but it can also increase secretions in the upper respiratory tract. As far as cough and cold agents in pregnancy, with decongestants, like I mentioned before, they should not be recommended by pharmacists, but only by the patient's physician. Guaifenesin and dextromethorphan are both pregnancy category C, and no guaifenesin should be taken in the first trimester. Dextromethorphan should only be recommended by the patient's physician if they deem necessary. And it is best to treat symptoms without medications, especially in pregnancy. And these therapies include humidifiers for congestion, nasal saline and neti pot, and warm water and teas to help with symptoms. For the over-the-counter pediatric products, the over-the-counter cough and cold products should not be used in children under the age of 4. The American Academy of Pediatrics approves combination cough and cold products for children 6 years and older. Advising parents to keep children with a cough or a cold well hydrated is very beneficial for their recovery and treatment during this time. And then vaporizers and humidifiers can be helpful during illness as well. It is important as pharmacists to know the pediatric dosing for both acetaminophen and ibuprofen. For acetaminophen, the dose is 10 to 15 milligrams per kilogram every 4 to 6 hours. And it's also very important to know what the over-the-counter product concentration is. When we're recommending doses for patients, we want to give them a dose that's going to be easily and effectively measured with the dosing syringe in the container. For ibuprofen, the dose is 5 to 10 milligrams per kilogram every 6 to 8 hours. And again, I've listed the concentrations for both the infant drops and the children's liquid. It's also important to always provide a calibrated oral syringe or dosing cup if it's not already provided in the container, or if the dose cannot be given based on the syringe that is provided in the over-the-counter product. It's also very important to counsel on the importance of not using a regular teaspoon from the kitchen and making sure parents know how inaccurate this dosing is. The next thing we'll be discussing is laxatives. Per the FDA, use of all over-the-counter laxatives should be limited to 7 days without physician supervision. The first category of laxatives is bulk-producing laxatives, such as psyllium, calcium polycarboxyl, and methylcellulose. These have an onset of action within 12 to 24 hours, and are the drug of choice for pregnancy. They are listed as a first-line agent for constipation, but adequate fluid intake is required. The side effects for these agents are increased gas and bloating. Docusate is an emollient and a lubricant stool softener, and is especially helpful for iron-induced constipation. This agent onsets within 24 to 48 hours, and it's typically taken twice a day. Sen and bisacodyl are both stimulant laxatives, and they're first-line agents in opioid-induced constipation. These are given at bedtime as they take about 10 hours to work. They should not be crushed or chewed, and the side effects are stomach upset and stomach cramping. For some acute treatments of constipation, we have magnesium salt, what's found in milk of magnesia. And this is an osmotic laxative. The onset is anywhere between 2 and 48 hours. We want to use caution with this agent in patients with renal dysfunction, and the side effects include excessive gas and electrolyte imbalance. Sodium phosphate or sweet enema is also an osmotic laxative. These onset very quickly within 1 to 5 minutes, but they do require adequate hydration. And these agents should not be used in patients with CHF or CKD. The side effects are excessive gas and electrolyte imbalance. Then we have polyethylene glycol. Its onset is typically within about 48 hours, and the dose is usually 17 grams dissolved in 8 ounces of water and drank once a day. Glycerin suppositories have an onset of about 15 to 30 minutes, and they should be inserted towards the side of the rectal wall. They are available in both adult and pediatric sizes. Magnesium citrate is another over-the-counter agent, and its dose is 150 to 300 milliliters per day, typically divided once or twice. However, if patients are preparing for a bowel prep, it's important that they take the specified dose just once as a one-time dose. Antidiarrheals are the next topic, and this includes bismuth subsalicylate. It exhibits both anti-secretory and antimicrobial effects when used as an antidiarrheal. And we want to use caution in patients on aspirin or anticoagulant therapy and those with renal failure. The biggest side effect here is a black tongue and stool, and this is fairly common, so it's important that patients are aware. Then we have loperamide, which should not be used longer than 2 days for self-treatment unless under the direction of a physician. The side effects here are cramping, constipation, and nausea. And it's important to note that the treatment of diarrhea should always include fluid and electrolytes. Moving on to over-the-counter ophthalmics, those for allergic conjunctivitis are naphthalene and phenyramine, ketotofen, and it's important to counsel patients to remove their contact lenses before using this product and waiting 15 minutes before reinserting. If multiple eye drops are used throughout the day, it is also important to counsel patients to wait 5 minutes between any ophthalmic product. And all ophthalmic agents may cause a slight or temporary burning and stinging of the eye. There are a couple over-the-counter otic products. The biggest one is probably the earwax removal agent, which contains carbamide peroxide. The ear should be flushed with warm water for 2 to 3 days after this medicine is used. And it's important to note for the patients, if this agent does not work, they should see a physician to get this removed. Removing earwax can be very dangerous, and patients should only do this if they know how to use the product safely. For ear pain, we typically will have a lot of patients asking questions about what to do about ear pain. The temporary use of acetaminophen and ibuprofen is recommended, but if pain persists, a physician diagnosis is recommended. And remember, eye drops can be used in the ear, but eardrops are never used in the eye. For motion sickness, there are several products over the counter. The first is a non-pharmacologic therapy, and it's a C-band, which uses an acupuncture point. These have been found to be very effective, especially in patients taking trips or patients who are pregnant who do not want to use oral therapies. There are a couple natural products that have been shown to be somewhat effective, and those are ginger and peppermint. And then there are the antihistamines, dimenhydrinate, meclizine, and diphenhydramine. Diphenhydramine, of course, is the most sedating of the three, like we mentioned before. There are a few over-the-counter agents for topical conditions. As far as acne, there is 2 products, mainly the benzoyl peroxide, which is the strongest over-the-counter agent. This, however, can bleach clothing and sheaths, and sun exposure should be limited. Salicylic acid is the second product, and it has been found to be a weaker over-the-counter agent, but is still effective in many patients. For dandruff, we have selenium sulfide, zinc pyrazole, and coal tar shampoos. These should be rubbed in and left for 5 minutes, and the shampoos should be used daily. Fungal skin infections are also very common. Aphid foot, jock itch, and ringworm are some of the things that pharmacists may have questions about. The products listed here, terbinafine, butadiene, clotrimazole, are the most effective over-the-counter agents. Creams usually work best and are used in most cases. However, solutions may be easier to apply to areas that contain hair. It's important to note that powders do not work well for treatment, but they may be used for prevention. And the product should be applied 1 to 2 inches beyond the rash, and should be used for 2 to 4 weeks, even if the area appears healed. Yeast infections are another very common topic pharmacists often receive questions about. About 75% of women will have at least one episode in their life, and half of those will have a reoccurrence. For mild to moderate and infrequent infections, a 1 or a 3-day treatment over the counter is usually effective. However, if it's a complicated infection or a recurrent infection, or if the patient is pregnant, 7 to 10 days of therapy should be used. The various products are listed here, and they include miconazole, tericonazole, teoconazole, clotrimazole, and butaconazole. It is important that patients avoid intercourse and, for females, tampon use during treatment. Eczema is another condition that parents especially will often ask pharmacists about, and hydration here is very essential. We can use moisturizers and maintain humidity in the home, and the treatments over the counter include topical corticosteroids and antihistamines for itching. As far as treatment for lice, the pyrethrins are the OTC drug of choice, and they can be used in children as young as 2 months of age. With lice treatment and removal, it is very important that we counsel on the importance of removing the lice and the nits from the child's hair and the bedding. Some additional agents to look at that we haven't had time to discuss here are the first aid products, especially those for poison ivy, poison oak, and poison sumac, diaper rash treatment, sunscreen, and cold sore treatment. The board typically doesn't ask a lot of questions on these agents, but as a pharmacist, it is very important to know all of the products that are available over the counter so that we can help our patients make educated therapy choices when they have questions about these products. That is the end of my lecture. I hope you guys possibly took something from this lecture that you didn't know before, or just got a little bit of an insight on what kind of questions the board may ask you. Like I mentioned at the beginning of the presentation, if you have any questions, please contact me at my work email given at the beginning of the presentation, and I will do my best to get back to you as soon as possible.